Hello, my name is Gloria Dawkins. I am a student at Aspen University. My course of study is Psychology and Addictions. My professor's name is April Bourgeois. On today, I'm going to discuss boundaries and how they work in counseling settings. In this presentation, I'm going to discuss the importance of professional boundaries. Boundaries are very essential in order to maintain the integrity of a therapeutic process, as well as to protect the client and practitioner. It is important to maintain boundaries that are clear, especially in the case of multiple relationships. Upholding boundaries is key in an effort to uphold clients' well being and ethical practices. Practitioners should avoid multiple relationships that could jeopardize the therapeutic relationship or create conflict of interest. Boundaries help to define responsibilities, roles, as well as expectations in order to ensure ethical and productive counseling sessions. They promote client autonomy and safeguard against emotional harm. Maintaining professional boundaries is necessary in counseling. It helps clients to work through their issues safely in a structured and supportive environment. Maintaining professional boundaries ensure that the counseling relationship remains client centered. Not maintaining professional boundaries can blur the focus and cause a shift from the client's needs to the counselor's need. It can jeopardize the therapeutic treatment as well as hinder effectiveness. An example would be if a therapist shared too much personal information or allows the relationships to become too familiar. It may cause a shift in the relationship and make it difficult for the client to feel secure. Maintaining professional boundaries allows objectivity, which is vital when providing guidance and unbiased support to clients. It protects autonomy, which ensures that the therapist does not impose their personal emotions or beliefs onto the client. Maintaining professional boundaries empowers the client to explore their own feelings and thoughts, take ownership of their personal growth, as well as make their own decisions. In cases when a therapist forms personal relationships or becomes overly emotionally involved with the client, their ability to offer professional and neutral guidance may be compromised. When this happens, it can lead to misjudgments, manipulation, as well as favoritism and bring harm to the client's counseling relationship. In some settings, avoiding multiple relationships may be impossible. Such include being a part of a community that is small, rural, or isolated. In these situations, sometimes a professional serves in well known roles in the community that has gained trust in the community, and so much that the members of the community feel comfortable when seeking professional counseling. Practitioners who work in rural communities have greater visibility than practitioners who are located in urban areas. This has a bearing on the way therapists may balance their professional and work life, as well as how they take care of themselves. Practitioners in small urban areas should make sure that they obtain informed consent, thoroughly document, ensure that clear expectations and boundaries are adhered to, matters pertaining to and ensure matters pertaining to confidentiality. Be part of a peer group in supervision, as well as participate in ongoing consultation. Working in a small town can present many ethical considerations, such as safeguarding the privacy of the client, In protecting the client's privacy or confidentiality, practitioners may want to assure their clients that they will not discuss their professional issues with them in public settings, such as in grocery stores, post offices, beauty salons, and other public venues. They should assure their clients that they will respect their preferences when interacting with them away from the professional settings. Practitioners should reassure their clients that they will not share their identity with anyone else, even when they are directly questioned. Another way of protecting the client's privacy in a small town, such as in a local bank setting, is to make other arrangements. Because the employees at the bank may know the practitioner's profession, the practitioner should discuss this with their clients and find out their preferences. If the client has discomfort concerning this issue, practitioners should make other arrangements for their clients to deposit their checks out to that checks that are made out to them elsewhere. Practitioners who practice in small town settings run the risk of seeing other clients in many settings, whereas in urban settings, it may be less likely. Practitioners should adjust their practice accordingly. Being a practitioner in a small community requires honesty, sensitivity, and flexibility. In small communities, it may not be particularly useful to only rely on rigid policies and rules. The practitioner must use creativity to adapt to certain situations as they unfold in these areas. Practitioners must always consider what is in the best interest of their client in any given situation. When considering multiple or dual relationships, counselors should balance this issue concerning multiple relationships by forming them only when it proves to be clear that the relationship is in the best interest of the client. They should make sure that boundaries are clearly defined, and when boundaries are crossed, it is done in a manner that is thoughtful and that it benefits their clients as well as fits the therapeutic context and carry risks that are minimal to the client. In today's society with social media on the rise, practitioners should establish clear social media policies that inform clients that their therapist cannot be their friend on social media platforms. In conclusion, practitioners should adopt guidelines to help manage multiple relationships. This concludes my presentation. Thank you.